Do you anticipate that Rhode Island falls in that category? Do you have any excess funds, and are you considering that?
So I would say that the 401 Works program that we put in place to maintain people contacted with that federal benefit has been a tremendous success. Matt Weldon told me earlier this week when I checked in with him, I think well over 10,000 people got reconnected into the workforce as a result of that. We're looking to appropriate several millions of dollars to get people connected back into the workplace. That's how we're going to use the federal dollars, to get people connected back into their workplace.
That's a yes.
We're going to use the money to get them connected back into the workplace with job training.
Governor, with the FDA approval, would you consider mandating the vaccine for kids over 12, and if and when it's approved for kids under 12, like other school vaccinations are required for whether it's the MMR or polio or chickenpox?
Well, I think that's a decision that'll be made by the Department of Health at some point in time, and also the Department of Education. At the moment, we're still doing very well. We asked the local school districts to put a mask policy in, a protocol in. Virtually everyone has. And now we're asking all the school districts, along with the school nurses and everyone else, to advocate for everybody to get vaccinated. There's no reason that we're not going to hit some really high numbers by doing it that way.
And even with the mask mandate in schools, I know there's still some concern among teachers and other people with the kids going back to school and infection rates higher. Are you at all concerned about back to school, whether kids getting sick or kind of the more practical scheduling issue of having to quarantine people and staff shortages and stuff like that?
Well, in the schools, we're comfortable that things are going to be safe. Follow the protocols that have been put in place by the Department of Health, follow the protocols that have been put in place by the Department of Education, as well as your local school district. We feel comfortable the students can get back into the classroom and that they will be safe.
Thank you. Wayne?
Excuse me, I guess this is a question for Dr. Alexandra Scott. You were talking about recommendations for small businesses, including restaurants, regarding vaccination, regarding testing, and masking. Are you recommending those for employees or also for patrons?
Definitely for employees, and we absolutely will support businesses who are interested in exploring that for patrons and customers as well. It's all about keeping as many people safe as possible.
You guys want to follow up?
This could be either for the governor or for you, Dr. Alexandra Scott. Is there any consideration being given to testing people arriving from very high areas with very high rates of infection, notably Texas and Florida, arriving at the airport, making that a requirement as opposed to an option?
Yeah, we continue to have the travel guidelines that are in place. That includes upon entering the state, if you're coming from a place with higher transmission, it's important to get tested. We want to make sure that that is clearly understood and can be reinforced. And that's really a part of why we want to bake into what businesses can access. The topmost steps that can be taken statewide include requiring vaccination, includes indoor masking, includes testing regularly, and ensuring that you have adequate ventilation. That's a great way to build confidence for Rhode Islanders to be able to continue to go out and engage in businesses or to travel here if we know we have systems in place throughout the state that ensure that everyone is healthy and safe.
Doctor, you discussed at great length the importance of masking in businesses as one of the 4 pillars of keeping people safe in small businesses and large businesses. You praised at some length the 9 theater groups that have required vaccination, testing, and so forth, and indoor masking for their guests. And you said that masking can reduce the risk of transmission by 70–80%. But as far as I know, the state is still not requiring or mandating that businesses expect their customers or their staff to wear masks. And is the state considering that? And if not, why not?
Yeah, it's always going to be my role to talk about what works. And these are the public health mitigation steps that are most effective. We want it done everywhere, and anywhere that it's able to be done. So, I'll leave the policy decision-making in terms of statewide mandates to the governor, and we'll continue to help make sure everyone's aware from a public health standpoint of what works the best.
Also, Doctor, this might be better addressed to Director McCarthy, but has there been, and I understand that Pfizer was only granted full approval by the FDA on Monday, and today's only Thursday. Has there been any indication in the state's measurements of data that has seen an uptick in vaccination as a result of that, or even at least correlated with that?
Yeah, we're still early on, but we are definitely anticipating an increase in vaccination uptake for all of those who were out there saying they wanted to wait until the vaccine was fully approved. We are ready. We've been waiting for you to definitely go ahead and get vaccinated and protect the loved ones around you.
Over here.
Governor, you evidenced great concern over a protracted period of time about the impact of the workforce on health care support. Just a week ago, hundreds of healthcare employees demonstrated on the State House rather convincingly using signs like "from hero to zero" that they would not comply with orders to either vaccinate and or use masks outside of the workforce. What is the state really ready to endorse the removal of these folks from the workforce when you're simultaneously willing to draw from retired folks in what appears to be a, I hate to use the word, desperate move to buttress the workforce?
So, that decision was made after talking to the nursing home board and their representatives, that they were supporting the idea of both mask and vaccine on their workforce. So we agreed. Remember this, healthcare workers keep people healthy. That's their job. And we know that, the booster shots are going to be needed, and they're going to be needed in areas of age groups that the healthcare workers spend an inordinate amount of time caring for them. So at that point in time, we need the healthcare workers to be vaccinated. It'll keep them safe, but it'll also keep the people in their homes safe and the people that they're providing care to.
All right, so you're willing to then allow institutions to walk away from that experienced workforce?
No, I don't think that's going to happen. I think that what you're going to see is just like in the schools. There was certainly a great deal of debate on whether the strategy to have local school departments adopt their mask policy, and that happened, and now we're in a better spot from where we sit to work with the local school districts and not get, because they're partners with us. I think that the nursing homes, the healthcare, facilities who have endorsed this, including your hospitals in the state of Rhode Island, they see the need to do this to keep out healthy. So my feeling is that you're going to work with everyone that you can to make it happen. I believe that inside the state that we manage in the LNS Slater, I think we have I was told yesterday, about 270 people yet to be vaccinated. We're going to speak to every one of them and show the personal tension and the need to have them vaccinated to keep the people that they care for safe.
Right. Then briefly, there is a great deal of anecdotal chatter amongst teachers and school department personnel around the state that the compliance in terms of pods, the compliance in terms of separation, the compliance in terms of ventilation is woefully lacking. Has there been an actual inspection of schools this summer in order to verify that this exists? And is that data available in any type of accessible format?
Yeah, I have to check in with the RIDE to see where that's available. I visited, I think, over half the schools in the city of Providence. I intend to do the other half. Look, we know a lot more today than we did a year ago. A great deal of the measures that have already been put in place will continue. The schools will be safe. The local districts are stepping up as well, as RIDE, as the Department of Health, and the state will as to make sure that the students are safe and the teachers are safe when they open up the classrooms in a few weeks.
All right, we have time for a couple more. Anita? Thank you. Governor, sorry, might as well stay up there. I have two questions on two different topics. First, for weeks you've been talking about possible mandates for state workers. Do you have a timeline on when you think that may happen? Because you indicated that a policy will likely happen. And where do those talks stand?
Yeah, so we're still in discussions. They haven't stopped. We anticipate that, those discussions will continue until there is a policy in place. But we have, we've got to work through labor leaders and and make sure that we get it all right. So those discussions continue today. They haven't stopped.
And on a unrelated topic, on Tuesday, you mentioned that you believe your Chief of Staff, Tony Silva, did nothing wrong in the Cumberland situation, yet 24 hours later. I mean, I have
I'll
Maria.
take your question out, sidebar. Let's stay focused on the COVID
was it
and the
for COVID
vaccinations, please.
questions. All right, last question, Brian.
Dr. Alexander Scott, could you answer the question about whether the Department of Health is considering mandating the vaccine for students as other vaccines are mandated?
Certainly, we know that that is a valuable tool, and want to work with our federal partners and our partners locally in putting in place all of the tools that can be most effective. Our schools have done a great job, but our role will also be how to continue this for going forward into the future. So it's absolutely something that is helpful for us to explore.
Is it on the table?
It's helpful for us to explore, yep.